Welcome to the MamasteFit YouTube channel. In this video, we're going to be doing a pelvic floor release workout. And so what we're going to be doing is moving the pelvic floor into different positions to help release common areas of tension. For a lot of us, we tend to favor a left hip forward, right hip back position, which can cause different types of tension within our pelvic floor. So we're not going to be doing the same movement on both sides, but there will be some bilateral exercises that we do as well. For this workout, we're gonna need some sort of soft object to place our hips onto. So if you have a pillow, I have a yoga bolster here. We're also gonna need a yoga block or like a small stack of books to help us come into a hip shifted position. We'll need a thin resistance band. You can also just use a strap, but if you have any sort of band, that would be super helpful. And then a foam roller. If you don't have a foam roller, you can also just use your pillows. But these are the 4 objects that I have set up to utilize during this pelvic floor release workouts. So once you've got your equipment, let's go ahead and get onto our backs to start our pelvic floor workout. So starting on your back, we're going to place our hips on to our pillow and then come into a supine position. So hips are going to be slightly elevated, have some flexion in the feet and the hips, so feet are flat on the floor. And then place your hands onto your rib cage. We're just going to focus on breathing here. So big inhale into your hands. Feel your ribs expand to the side. Feel your back push into the floor. And then exhale, just release and let go. So big inhale into your hands. And then exhale, just release and let go. So diaphragmatic breathing is a great way to move our core, to stretch our pelvic floor, and then a really great way to help us down regulate and activate more of our parasympathetic nervous system, which can help us to release tension in that pelvic floor. The slightly elevated hip position also can help to take gravity off the pelvic floor. So just continue breathing. Big inhale. Exhale, let go. And now we're going to come onto our side, either place the pillow or the foam roller between your thighs. And we're going to place one hand underneath the head if that feels more comfortable for you. You can also just put the pillow underneath your head as well. And I'm going to think about driving my top knee forward and then driving it back. So I have my left leg up. You can have your right leg up. Either one is fine. So I'm going to drive that top leg forward to feel a little bit more of a stretch in that bottom hip. And then I'm going to drive the top hip back to feel a little bit more of a stretch in that top hip. And so it's going to be a very mild movement, but we're just adding in a little bit of hip and pelvic mobility. So I'm finding my closed hip position and my open hip position. Squeeze that pillow or that foam roller as you go back and forth to kind of turn on the inner thighs a little bit more. Sometimes we have a little bit of pelvic floor tension because things are stuck. And so adding this little bit of pelvic mobility can be really helpful to releasing tension. So go ahead and release that foam roller. And now we're going to grab onto our yoga block to come into a deep squat position. And now if you need some more support in the deep squat, you can place your pillow underneath your heels as well. So I'm going to come into this deep squat. Feet are a little bit wider than hip distance, and I'm sitting down on the yoga block. If you want to move a little bit deeper, you can remove the yoga block, but it's not mandatory, or you can just come to like a lower setting on the yoga block. So we're just going to breathe down into the pelvic floor, and if you can, find a little bit of rounding in the back. So big inhale. We're going to think about rib cages expanding, and you should feel a little bit more pressure down to the back half of the pelvic floor. Exhale, just let go. Big inhale into your back. Exhale, let go. Now, if you're feeling a lot of pressure to the front half of the pelvic floor, you may be a little arch or maybe a little bit forward into the toes. Sit down on the block so that we can find that slightly rounded position. Now let's come into a half lunge position. So right leg is going to be in an open hip position. Belly is coming away from the thigh. So you're kind of doing like a Captain Morgan's position. So big toe, I'm putting weight into that right big toe. And then I'm thinking open up in my hips so I feel a bit of a stretch in that right groin. And then shift into that hip, keeping weight in that right big toe. And then keep thinking rotate to this open position. This is going to help to stretch that right groin area, and you kind of rock in and out of it as you need. And also to help offload the right half of our pelvic floor, which for a lot of us tends to have a little bit of overactivity. And so you can do this movement on this side, and if you don't find that it's much of a release, you can try it on the other side as well. But in this workout, we're only going to do the right side because our pelvises are asymmetrical. We're not evenly distributed throughout the whole pelvic floor. And so one side of the pelvic floor tends to have a little bit of tension versus the other, which can be a normal setup of our pelvis. So keep weighting that big toe. And now we're going to move on to an exercise to release the left half. So you'll take your yoga block, you're going to place it underneath one knee, and I'm going to shift my weight over to that elevated hip. So I'm placing it underneath the left knee, and then I'm going to shift my weight to that left side. And then drop the belly to the floor, and then exhale, pull belly to spine as you round. So in this movement, making sure that we're keeping the weight over into that left knee, you should feel a big stretch in that left kind of hip pocket area. With the pelvic tilt, you should almost feel like your pelvis is rotating on top of that femur head or the top of your thigh bone. So inhale, drop belly to the floor. Exhale, pull belly to spine to round. And this is another pelvic mobility exercise similar to that second movement that we did, the side lying hip shift. This is an all fours hip shift. So we're moving the pelvis on the femur, coming from that open to closed hip position to help improve pelvic mobility, to stretch the pelvic floor, especially in the back portion. So now let's come into a 90-90 position. So right leg is going to be in front, left leg is going to be behind. And then I'm going to take my long band, holding it in my left and my right hand. And so for a lot of us, right leg likes to be more internally rotated and left likes to be external, and so we're opposite. Hold the band out in front, and I'm going to row back with that left arm as I reach forward with the right hand, and then coming back. So this is bringing us into the opposite position that we tend to like to be in. Usually, we prefer the opposite leg position. So right leg back, left leg forward. And usually, we like to have more compression to the right side of our body and more expansion to the left. And so some of our issues with pelvic floor tension could be that the setup is a little bit off. And so this is bringing us into the opposite to help release some of the tension in the hips within the pelvic floor. And then this is also adjusting the rib cage position to help us move our pelvic floor a little bit better. So exhale to come, think almost like crunching to that left side, and then go back. And now we're going to finish up with some child's pose. So we're going to start with knees a little bit wider, and we're going to come back and sit to our heels. You can come all the way down if you'd like, and we're going to think round in that upper back. Breathe here into the back, and then exhale, let go. So it's important that we have the rounding in the upper back. If you're more arched here, we're not going to be able to breathe into that back space. For a lot of us, if we're having tension within the pelvic floor where it's contributing towards symptoms for us, so we're feeling heaviness, we're having issues with tailbone pain, pelvic pain, it's because we're not expanding enough in our backs. Because a lot of us tend to favor that more extended position. And so breathing into this back space can help us to release that tension in the back half of our pelvic floor. where a lot of us tend to hold a little bit more. So continue to breathe here. Think big inhale into the back. Exhale, just let go. And now we're going to bring the knees a little bit closer, ankles slightly out, and we're going to rock back and forth. Your hips will probably not touch the floor, and that's okay. So inhale to come forward, exhale to come back and round in the back. As you come forward, you may find it more of a neutral spine position, maybe a little bit more of an extended position. But when we come back, we have more of that rounding. So all of these different hip positions stretch different portions of our pelvic floor. And so it's important when we think about pelvic floor release that we're not just doing deep squats and butterfly poses, that we're incorporating open and closed hip positions. We're incorporating wide knees and closed knees. And we're thinking about diagonal positions as well as asymmetrical movements. Go ahead and come back to a seated position, and this concludes our 10-minute pelvic floor release workout. You can go back and explore any of those exercises, especially the ones that felt like you needed a little bit more time in, or maybe you wanted to try the other side. With our pelvis, a lot of us, the left hip sits more forward, right hip sits more back, and this contributes towards a really common pelvic floor positioning. Typically, the right half of our pelvic floor is a little bit overactive, which is why we emphasize that open hip position on the right side to help offload that half of the pelvic floor. And because we have that tilt in our pelvis, it contributes towards a left posterior pelvic floor to be very tight. And so that all fours hip shift was really helpful to releasing tension in the back half of that pelvic floor. We then moved into that 90-90 where we had right leg in front, left leg behind, because a lot of us tend to favor the opposite position. And so this is bringing our pelvis into the opposite orientation that it tends to like for more of a release. And then we added in the upper body movement to help kind of move the rib cage in a position, because our pelvic floor tension relies on the positioning of it. How the pelvic floor is positioned is going to relate to how the pelvis is positioned, which relates to hip orientation, glute and adductor tension, in addition to how our rib cage is positioned. So nothing is working in isolation. And so hopefully this quick pelvic floor release exercise gave you some movements to explore, released a little bit of your pelvic floor. And if you enjoyed the video, be sure to like and subscribe to the channel so you get notified whenever we release new workouts on Tuesdays. And then if you want more daily workouts, check out our online prenatal and postpartum fitness programs. We incorporate tons of exercises within the workouts to help prepare your pelvic floor for birth, to release tension within your pelvic floor, to help optimize function to support your entire motherhood journey. You can check out all of our fitness programs on our website at MamasteFit.com and use code YouTube10 to get 10% off any of our online offerings. And you can bundle things together to save an additional 15% off. So thanks so much for watching. I hope your pelvic floor is feeling great. And be sure to subscribe so you get notified whenever we release new videos.